Patrick is a 49-year-old male who was weighing around 140 kilos when he came to us a month back. He was finding it quite difficult to walk because he was feeling unsteadiness. He was feeling all the four limbs have been more and more clumsier by the day, and he also had back pain radiating to the right leg. He was referred to us for mainly the back symptoms and the leg symptoms, and people had suggested a surgery for his low back. However, when he came here, we found that he has more of a cervical myelopathy than a lumbar spine problem alone.
My name is Nwebunu Patrick Chukwudi. I came from Nigeria for medical treatment. I have a spinal problem for over 5 months before I came here. I've run around Nigeria hospitals to treat myself, but nothing was done. All the hospitals that I went to, after staying for weeks, months, the pains keep on increasing. My legs and my hands, my body. My legs almost stopped moving me. So I now went to one Vedic hospital. So after the test and rest of things, they said that I have a spinal problem, that they cannot treat it in Nigeria. That the best thing for me is to travel to India, where they have the equipment to do the surgery. And when I came to India, to Manipal Hospital, then they directed me to spine session, where I met Dr. Bidara. He took me around. We went for tests, MRI, another test, so many tests. So after that, the point that I have a spine problem, one at the neck, the other one at the waist, at my waist. But in Nigeria, they can only find the neck. They didn't see the waist. So it's here in India, Manipal Hospital, that they discovered that I still have the same problem I have at the neck and the waist. So he said that we have to do surgery.
We did x-rays of his lumbar spine and the cervical spine, and you see that the MRI of the cervical spine shows very gross spondylotic changes in the mid-cervical region and compression of the cord with the signal intensity change in the cervical spinal cord, which is not a good sign. The X-ray of lumbar spine showed a grade 1 lytic listhesis of L5/S1 as shown here, and a disc prolapse at the same level. He was planned for a single sitting surgery for both the neck and the back. First, we tackled his neck by way of C5 corpectomy, that is, we are removing one entire bone from the neck of the patient, and replacing it with an expandable cage as seen here and fixing it up in position with a plate. Next, we flip the patient prone, do a surgery for his low back by realigning the bones, fixing them with the screws and removing the disc and replacing it with the cages filled with the local bone graft. The patient tolerated a 6-hour long surgery very well. He had lost around 650 ml of blood, and both these cervical and lumbar spine surgeries were completed in one go. He was mobilized on the day after surgery, and he is walking well now after a month of surgery with minimal support of a walking stick.
Vidara and his team, we went to the theater. They do the surgery, successful. They come out successful. So I thank them. They are good people. They are good friends. They will make you happy, make you as if the way they treated me here, the team, they are all good. Vidara and I've forgotten the other names of the doctors. They are all good. They are good people. They treated me well. So I'm happy for them. I'm happy for Manipal Hospital. I'm happy for Indians to have this kind of a thing for people. Because they don't have this kind of a thing, this kind of a hospital for people taking good care of people, taking good care of life, not money. I don't think I'll be here now talking as I'm talking. So I thank everybody in Manipal Hospital. Now, as I'm sitting here, I'm 100% okay. 100% okay. My bodies are not paining me anymore. I can walk, I can sit, I can lie down on the bed. So when I go back to Nigeria, if anyone had this type of problem that I have, instead of looking that person to die like that, I will advise the person to come to Manipal Hospital. That if he comes to Manipal Hospital, his problem will be solved 100%.